The symptoms of pelvic pain can be very varied, and they can be in isolation, or they can come as a multitude of symptoms. The most common symptoms that I see and hear from women are of painful periods, painful intercourse, non-cyclical pelvic pain. So that's pain that persists throughout the month. But other symptoms that are common are pain passing urine or pain when opening your bowels. And that can indicate either more severe forms of a condition like endometriosis or to an entirely different course of pain. There are many different causes of pelvic pain, some of which are from a gynecological origin and some which aren't. For a pelvic pain specialist, as someone like myself, it's important to consider all of those causes. Narrowing down the possibilities itself requires a careful history followed by examination and imaging. For example, pain that is very acute might point to an ovarian cyst accident or a urinary tract infection or appendicitis. But pain that's chronic, it's more long-standing, that's more likely to be related to endometriosis or irritable bowel syndrome, for example. For anyone presenting with pelvic pain, it's very important to first consider any so-called red flags. Those are symptoms that might indicate an underlying malignancy, and they can sometimes be quite subtle, such as bloating or nausea, or they might be more obviously abnormal, such as bleeding or weight loss. So it's very important to consider individual patient characteristics, age, menopausal status, because that will very strongly influence how much your doctor suspects something very serious, such as a cancer, could be an underlying cause. Either if it's very acute and severe, and then a surgical emergency must be considered. That could be something like an ovarian torsion or an appendicitis. But if it's longer term, if it's associated either with red flag symptoms that might indicate a malignancy, or more commonly for the women that I see in my clinics, it's when it's impacting on quality of life. So I very often see women with endometriosis where the symptoms and the impacts on their well-being is very significant, and it can lead to the breaking down of relationships with work or family, for example. So anything that is having a severe impact on someone's well-being must be addressed with seriousness. The most important starting point for talking about treatments is first identifying the cause. Antibiotics will treat pelvic inflammatory disease, but if that's become a pelvic abscess, then that may require a surgical drainage. So it's very important to individualize the treatment options and have an open discussion about what suits that person at that time. Again, for example, many women with endometriosis symptoms will be able to manage their symptoms with contraceptives, but that might not be appropriate at all for someone who's trying to conceive.